Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. CyberKnife Radiosurgery for Brain AVMs. Introduction. CyberKnife Radiosurgery is a non-invasive treatment that delivers high doses of radiation to destroy arteriovenous malformations, or AVMs, of the brain. Your doctor may recommend that you undergo CyberKnife Radiosurgery for your AVM. The decision to have this procedure is also yours. This patient education tutorial reviews what AVMs are and then explains what radiation therapy is and who can have CyberKnife radiosurgery for the treatment of AVMs. The program explains the procedure, its benefits and risks, and what you should expect after it. AVMs. The brain is the control center of the body. It is inside of and protected by the skull. It is fed by many blood vessels. Arteries coming from the heart that go to the brain divide into smaller arteries. These smaller arteries then divide into capillaries, or very small blood vessels. These blood vessels allow the oxygen to go from the oxygen-rich capillaries to the cells of the brain. In return, carbon dioxide passes from the cells of the brain to the capillaries. The capillaries then form bigger blood vessels that get together to form veins. These veins take blood back to the heart, where it is pumped to the lung to get oxygen. AVMs are abnormal tangles of blood vessels in which the arteries may connect directly to the veins without the intervening small blood vessels and capillaries. Sometimes these abnormal blood vessels balloon, producing aneurysms. Symptoms and their causes. Arteriovenous malformations, or AVMs, or the aneurysms associated with them, may create pressure on and squeeze the brain. This can cause seizures, weakness, blindness, and other neurological symptoms. AVMs use a lot of blood, so the amount of blood that flows into an AVM is very high. Because of this, the surrounding brain may not get enough blood. This can produce stroke-like symptoms. This is also referred to as steal phenomenon, because the AVM steals needed blood from the surrounding brain. An AVM or the associated aneurysm may also cause a brain bleed or hemorrhage around the brain or into it, which may cause severe neurological problems. An AVM may be discovered when a brain CAT scan or MRI is done. This MRI scan shows an AVM with its tangled vessels.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Treatment options. There are several options available to treat AVMs. These include surgery, embolization, and the use of radiation. The location and size of the AVM, as well as your age and medical condition, determine which treatment options are best for you. Surgical treatment is the only option that immediately takes care of the problem and decreases the chances of a future bleed. However, it may not be the recommended treatment if the AVM is in a deep part of the brain or in a critical location such as the speech center of the brain. Small AVMs in difficult-to-reach places in the brain may respond to radiation therapy. Radiation therapy causes the blood vessels to clog up and the risk of bleeding to decrease. It takes between 1.5 years to 2 years before the blood vessels clog. During that time, the brain is not protected from the risk of bleeding. Radiation therapy is not always successful at causing such a clog. Radiation therapy also has possible risks. It could lead to strokes near the AVM. If an operation is considered, often the doctor performing the angiogram may attempt to clog part of the blood vessels with small particles or special glue. This type of angiogram is known as embolization. This helps decrease the blood flow to the AVM and usually makes the surgery to take the AVM out easier. The location of some AVMs may make embolization impossible. In addition, embolization decreases the flow for only a short period of time and is not considered a long-term treatment for AVMs. There are also risks to angiography and embolization. These include, but are not limited to, strokes and bleeding. Radiosurgery. External radiation therapy uses a machine to focus high-energy beams of X-rays or other particles on cells. This energy beam damages the walls and the lining of the blood vessels, which can possibly lead to a clog which shuts off the blood flow. Healthy cells are also affected by radiation therapy. The aim of any radiation therapy is to increase the damage to the AVM without affecting surrounding healthy tissues. In order to decrease the effect of radiation therapy on normal tissues, the total dose of radiation can be divided into two rays that come from different directions and intersect or come together in the area of the AVM. By dividing the dose into two rays, the radiation affecting normal cells is half of the radiation received by the AVM cells. Radiosurgery works on the same principle. By dividing the radiation in many smaller beams, it not only decreases the dosage given to normal tissue, but also increases the dosage given to the AVM and allows the doctor to better shape the area where the radiation is delivered. Stereotactic radiosurgery is a way of treating brain lesions with a precise delivery of radiation that follows the exact shape of the lesion being treated. In most cases of stereotactic radiosurgery, the head is immobilized by a special frame. CyberKnife. Unlike other radiosurgery techniques, CyberKnife radiosurgery does not require rigid immobilization with a frame attached to the head to treat a brain AVM. It can be used to target larger brain AVMs that cannot be treated with some of the other types of radiosurgery. The CyberKnife machine includes the following parts: an X-ray generator, a robot that can rotate around the patient and aim the X-ray beams at the lesion from different directions, a tracking system that helps to adjust the robot's position based on slight movements of the patient's head. CyberKnife treatments are performed on an outpatient basis, with each treatment lasting between 30 to 90 minutes. The number of treatments varies depending on the AVM size, location, and shape. Typically, only 2 to 5 daily sessions are required. The CyberKnife allows patients to lie comfortably on the procedure table without anesthesia, while the robotic arm moves without touching them to treat all areas of the AVM. CyberKnife technology can be used to treat AVMs, cancers, and some other abnormalities of the brain and cranial nerves. Make sure to discuss with your doctor your type of lesion and whether or not the CyberKnife is the best technology to treat it. This tutorial focuses on brain lesions that can be treated with the CyberKnife procedure. The following are the benefits of CyberKnife radiosurgery. 1. Because it does not require surgical incision, the risk of hemorrhage, infection, and leakage of the fluid around the brain are decreased. 2. It does not require you to have any device attached to your skull. It decreases the amount of radiation that nearby healthy tissues receive. 3. It is an outpatient procedure and does not require a stay at the hospital or medical facility. Depending on the type of AVM, CyberKnife radiosurgery allows most people to resume regular activities immediately after treatment. Alternative treatments. Because all forms of radiation treatments work over time, they may be inappropriate if symptoms are severe or life-threatening. Relief of acute symptoms may make open skull surgery or medication necessary. Your doctor will talk to you and discuss if open skull surgery is necessary. Healthy brain tissues that are critical for important bodily functions may be located too close to the AVM. If this happens, it may not be safe to treat certain areas of the AVM, and the surgeon may have to limit how much of the AVM he or she treats. Embolization is another treatment option. The location and type of the AVM may make embolization either ineffective or dangerous. Traditional radiation therapy can be used to treat AVMs. Your doctor can determine if traditional radiation therapy is recommended for you. The risks of traditional radiation therapy and CyberKnife are similar. Those of traditional radiation therapy may be more significant due to the higher levels of radiation delivered to normal brain tissue. CyberKnife Radiosurgery has the benefit of easily treating a large AVM area. Moreover, it does not require that you have a device attached to your skull to keep your head from moving. Before the procedure. Before the procedure is scheduled, you will meet with your neurosurgeon and radiation therapist who will decide whether you are a good candidate for CyberKnife radiosurgery. This depends on many factors, including the location and type of AVM, as well as your age and your medical condition. If your neurosurgeon and radiation oncologist determine that you are a good candidate, they will then schedule you for CyberKnife therapy. You will be scheduled for 2 initial visits. During the first visit, a mold of your face and head will be made. The second visit is to deliver the radiation. During your first visit, your healthcare team will obtain an angiogram, MRI, or CT scan of your head with the mask to determine the exact location and dose of radiation to be delivered. The making of the mold or mask is not painful. The mask is used to help keep your head steady during the radiation treatment. Usually you should not eat or drink anything after midnight on the day of your scheduled radiation treatment. This will decrease the likelihood of having an upset stomach during the procedure. Ask your doctor for instructions regarding eating, drinking, and what medications to take the night before the procedure. CyberKnife radiosurgery is an outpatient procedure, which means you will go home the same day. You will need to have someone accompany you. This person should be able to drive you home and authorize emergency medical treatment if necessary. On treatment days and before the treatment starts, you will be asked to remove all jewelry. It is probably better not to bring it with you. Procedure. When you arrive for your pre-treatment evaluation, you will be asked to remove all makeup, hair pieces, contact lenses, eyeglasses, dentures, and other portable devices. If you become anxious, you can ask your doctor for a relaxing medication, which is usually given orally 30 minutes prior to the procedure. After the mask is placed on your face, you will be taken to an imaging area where pictures of the inside of your brain are taken. An MRI or CT will be performed, which will show the exact location of the lesion. Sometimes both an MRI and a CT scan are performed. After taking the images, you will be sent home. Your doctor and the healthcare team will plan your radiation treatment using very sophisticated computers and software. They will decide how many areas to treat and what the appropriate radiation dosage is for each area. They will also plan how they will best target each area of the lesion with radiation. When the treatment plan is finalized, your doctor and the healthcare team will contact you regarding your treatment plan. The physician will tell you how many treatments to expect and how long each treatment will be to receive the proper amount of radiation. The day of the treatment, you will be brought into the CyberKnife treatment area and placed on the couch with the mask placed over your face. The staff and physicians will go to another room to administer your treatment. You can still talk with your physician through a microphone. In addition, a camera will be used to allow the staff to see you at all times. During treatment, you will not feel or hear anything from the CyberKnife radiation. The robot will move and deliver the radiation from the planned locations. You will hear the sounds of the robot's motor as the robot moves. The total treatment time may take 30 to 90 minutes, depending on the size of the area to be treated and the dosages needed for effective treatment. After the procedure. Immediately after your treatment session is completed, the mask will be removed. Tell the staff if you have a headache or nausea and need something to make you feel more comfortable. At this time, you will be allowed to drink and eat. You may rest at the center until you are ready to go home. You should follow up with your physicians to check on the progress of the AVM and treatment.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Risks and complications. Like any radiation treatments, this procedure has certain risks and complications that you should know about. Knowing about them may help you treat them early if they happen. As with all radiation treatments, the cells of the irradiated AVMs may develop edema or swelling. If swelling occurs, you may experience nausea and vomiting. In rare cases, it can cause seizures and other neurological problems. Your doctor may prescribe a steroid medication to reduce the swelling and anti-seizure medication to control seizures. The irradiated tissue will typically shrink after treatment. On rare occasions, this dead tissue can cause further problems and may require removal through surgery. This dead tissue is known as necrosis. The side effects of CyberKnife radiosurgery are the same as those of traditional radiation therapies, however they are less frequent and less intense because healthy tissues receive less radiation. Side effects include tiredness, which can be reduced by resting, hair loss, which is usually temporary, irritated skin in the targeted area, which can be controlled with a special lotion. Conclusion. CyberKnife radiosurgery is a non-invasive treatment that delivers high doses of radiation to destroy brain AVMs and other lesions. Radiosurgery minimizes radiation exposure to healthy tissues surrounding the AVM. The CyberKnife uses a robotic arm to deliver highly focused beams of radiation. The flexibility of the robotic arm makes it possible to treat areas of the brain without your skull being attached to a rigid frame. Like any medical procedure, CyberKnife radiosurgery involves some risks and complications that you should know about. Knowing about them will help you treat them early if they happen. CyberKnife radiosurgery has several advantages. Because it does not require surgical incision, the risk of hemorrhage, infection, and leakage of the fluid around the brain are decreased. It does not require you to have any device attached to your skull. It decreases the amount of radiation that nearby healthy tissues receive. It is an outpatient procedure. This allows you to resume regular activities immediately after treatment. Thank you for using Explain.